From data on the Ghana Health Services website, it is quite obvious that contact tracing and testing have reduced. There are also reports that it now takes a longer time for test results to be ready as compared to earlier in the year. The question is why we have relaxed all these critical measures when in reality we are seeing more infections and fatalities. The Director General of the Ghana Health Service has been providing some answers.
The laboratory requires a lot of, for PCR, reagents, pipettes, all manner of things apart from that, and the test kits. It's a global scramble for them. So even sometimes when you have money, you don't always have one. But we know that by end of this weekend, we are having a consignment arriving, and so hopefully next week we will start ramping up the tests and reduce the delay. But our idea is that if there's a cause to take your sample, you are supposed to isolate yourself. If there's any reason to take your sample, it means that you are potentially positive. So until you hear your results, please try as much as possible to self-isolate.
50 districts across 10 regions have recorded 496 new COVID-19 cases, pushing Ghana's total cases to 18,630. The death toll remains 117, while recoveries have increased to 14,046. The Director General of the Ghana Health Service has been given the breakdown.
Greater Accra remains the region with the highest new cases. That was 209 cases from 18 out of the 28 districts in Greater Accra. Ashanti follows with 158 new cases in 11 districts. Bono East had 35 new cases from 4 districts. Eastern Region 27 new cases in 5 districts. Ahafo has 18 new cases in 1 district. This is a localized outbreak. Western has 17 new cases also in 1 district. Upper West reported 14 new cases in 5 districts. Central 10 cases in 2 districts. Water had 2 in 2 districts, and Western North had 3 from 1 district. Upper East, Northeast, Oti, Bono, and Savannah did not report any positives as at yesterday.
Government says it has embarked on the expansion of COVID-19 treatment centers across the country. Listing some of the facilities, Dr. Patrickuma Boache said the expansion was to make more beds and logistics available for COVID-19 case management.
Currently, we are looking at about 12 infrastructural upgrades across the country. Some in the north, Zebila, I presented Dodowa one, I presented the Pantine one, and among others, the whole ones. Across the country, there are about 12 of them that is being upgraded. So, and that's where we showed you some of them. Maybe we'll visit and also take the media around to see the status of them. Currently, the upgrade in Kumasi South will be ready this weekend. That's my information. We are giving them some prefab from accommodation, and they have expanded to move to about 30 beds out from 18 beds.
The Greater Accra and the Ashanti regions have recorded over 70% of all cases in the country. They have been declared COVID-19 hotspots in the country. There have been calls for localized lockdowns due to the exponential growth of COVID-19 cases in these regions. Information Minister Kojo Ponkruma said government was still considering its options in curbing the spread of COVID-19 in such areas, and the option of reintroduction of localized lockdowns was still one that was open to government.
All cards remain on the table. His Excellency the President, in the earlier announcement to ease some of the restrictions, mentioned that this was a phased easing which will be observed, and then depending on the lessons or the outcomes, decisions on the next steps will be taken. So all cards remain on the table. As the analysis goes on of how we have complied with these, may I say, bits of the easing, it will inform the next line of action.